You ready? Okay. The July 28th, 2026 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Blankley. Here. Mr. Blankley is present. Ms. Bonnick is excused. Mr. Cruz is excused. Mr. Dondorfer? Here. Mr. Dondorfer is present. Ms. Hasman?
Here.
Ms. Hasman is present. Mr. McCabe? Here. Mr. McCabe is present. Mr. Milne is excused. Ms. Smith? Here. Ms. Smith is present. Ms. Vasquez-Simmons? Here. Ms. Vasquez-Simmons is present. President Ramon? Here. President Ramon is present.
Is there anyone signed up for the public forum?
There is one speaker signed up. The clerk will call you forward, and you'll have 2 minutes in which to address the legislature. When the buzzer sounds, we just ask that you conclude your points. Our first speaker is Isabella Rosa.
See right here. Yeah. All right. Hello, everyone. My name is Isabel Rosa. It's nice to see everyone. I work at the Children's Agenda. If you don't already know, we're also on the Monroe County website. We are on there as advocates and defenders of the children, if you will. And that is due to our amazing research and reports that we put forth representing children. The Children's Agenda has a few movements that we lead: early intervention for Kids Can't Wait, solutions not suspensions. We have one that's called basically Ending Child Poverty, and we also have one for universal child care. I also represent a group of approximately 80 parents from the Monroe County area. These parents are known as the VIPs, the Very Invested Parents. The VIPs are very involved in changing systems, policies, and legislation that do not benefit children and families, and even more specific, those who live in poverty. I'm here today to talk about the Universal Child Care Initiative investment that the Governor of New York has allocated for Monroe County. We at the Children's Agenda are currently obtaining feedback from families, child care providers, leaders, and community advocates as it relates to what we would like to see the Universal Child Care Program roll out look like here in Rochester. We are hoping to collaborate and join the county in the rollout of this child care initiative in Monroe County. We want to make sure all children get this amazing benefit that will be coming our way. We want to make sure that families obtain child care for any of their children without a challenging process or barriers. We have valuable input, and we are asking Monroe County to please consider allowing the Children's Agenda and the VIPs to be involved in this process. I ran out of time, didn't I?
Yes.
Okay.
Summarize.
I think I made my point. Thank you.
Thank you. Is there anyone present who is not signed up to speak who would like to address the committee at this time? Seeing none, the next item on the agenda is the approval of minutes. You have the April 28th, 2026, and the May 19th, 2026 meeting minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Madam Clerk?
Referral number 26-0213, authorizing a contract with Popley Architecture and Engineering and LSDPC for professional design services for the medical examiner, Amers Building Expansion Project.
Moved by Legislator Vasquez-Simmons, seconded by Legislator Blankley. Is there any discussion? Yes, Legislator Dondorfer.
Thank you. Through you to the administration, with this expansion of the building here, can you provide us any update on the current wait times at the Office of the Medical Examiner?
Good afternoon, through the chair. Current wait times, it's on average about 8 to 12 months, but we do have a new physician who is well under that average. because there is no backlog for that particular physician. And we are positioned to hire a new forensic pathologist starting in October, which will greatly assist in allowing our backlog physicians to greatly focus on their backlog and not to do incoming cases. Through the chair.
Thank you, and through the chair to the administration, based on what I've heard in the past, how have these wait times improved? It seems to be going down. Is that trending in the down direction?
Through the chair, yeah, absolutely. It is a downward trend. Again, the third doctor with a no load is really helping that. Our toxicology lab is back on point after a brief hiatus, as you might recall, when we had switched off to a more commercial lab to perform the work. Our lab has been restructured, reorganized, and is performing a lot better. In general, our office has received some substantial assistance in making sure we're up to staff and our not physician staff. So we're really running hot and able to handle the load a whole lot better. Through the chair.
Great, thank you, and thank you for the improvements in there and working as hard as you guys do. I yield.
Any other discussion? The chair would like to recognize legislators Cruz and Bonnick. All those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item, please.
Referral number 26-0214, authorize a contract with DeMarco Constructors for agency construction management services for the medical examiner's Ames Building Expansion Project.
Moved by legislator Vasquez Simmons, seconded by legislator Blankley. Is there any discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item, please.
Referral number 26-0219, accept additional funding from the New York State Office of Mental Health, amend Resolution 424 of 2025 as amended by Resolutions 111 of 2026 and 197 of 2026 to increase the contracts for the provision of mental health services in 2026 for the Monroe County Office of Mental Health.
Moved by legislator Vasquez Simmons, seconded by legislator Blankley. Is there any discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item, please.
Referral number 26-0220, authorize a contract with United Way of Greater Rochester and the Finger Lakes, Inc. for the Monroe County Age-Friendly Implementation Plan for Older Adults.
Moved by legislator Vasquez Simmons, seconded by legislator Blankley. Any discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral number 26-0221, authorize a contract with Villa of Hope to provide mental health therapy and medication services.
Move it.
Moved by legislator Vasquez Simmons, seconded by legislator Blankley. Is there any discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral number 26-0236, amend the 2026-2031 capital improvement program and the 2026 capital budget and appropriate assigned fund balance for the project entitled MCH Dialysis Unit.
Move it.
Moved by legislator Vasquez Simmons, seconded by legislator Blankley. Is there any discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral number 26-0237, enact a local law entitled Authorizing Lease by Negotiation with University of Rochester for use of space at Monroe Community Hospital for Community Dialysis Unit.
Move it.
Moved by legislator Vasquez Simmons, seconded by legislator Blankley. Is there any discussion? I would just like to declare my interest.
Noted. Thank you.
All those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item, please.
Referral number 26-0243, acceptance of monetary proceeds from the sale of Monroe Community Hospital's equity share in the Pantheon Optimization Alliance.
Move it.
Moved by legislator Vasquez Simmons, seconded by legislator Blankley. Is there any discussion? Legislator Smith.
Thank you.
Thank you, Madam Chairwoman. Since MCH counted on these annual dividend disbursements, will this lump sum be allocated annually to keep their budget intact? Or are those funds being held exclusively for MCH, or have plans to use this money elsewhere in the county budget?
Through the chair, MCH currently is, in the financial statements, in the non-spendable category, has $13 million owed to the general fund. This will recover some of those funds and repay the general funds for the advances that we've provided.
Thank you. I yield the floor.
Any other discussion? All those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Are there any other matters to come before this committee? See, there being no other matters, the July 28th, 2026 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, August 25th, 2026 at 5 p.m.